Chelation therapy, one of the things that we do here at Natural Medicine and Detoxification, and have been doing so for several years. Dr. Fontes and myself, Dr. Murphy, have been members and attended the American College for the Advancement of Medicine. And in 2019, we both certified in chelation therapy. This really makes us very knowledgeable by several intensive days of training and testing. And when we think about chelation therapy, it's really the word chelation that many people wonder about, because it's a funny word. Chelation is like the ability to pick up toxins and toxic metals with a claw, like you might take lead or mercury and grasp the toxic metal and be able to excrete it through the kidneys and through the biliary and intestinal tract. Chelation is actually from the Greek word keel, which is to claw, and so that's exactly what the molecules of chelation therapy are designed to do, and that is to grasp and excrete toxins and toxic heavy metals out of the body. With that in mind, we also think about potentially provoking and measuring the toxins to see how much someone is capable of excreting through their urinary tract. So that's one of the things we might ask you to do at the very beginning, to really know and really show you how the chelation can benefit you based on your heavy metal levels. Chelation also has been shown to distinctly improve the functioning of our cardiovascular system and our arterial system. And so one of the areas where we feel great about helping people is preventing, at least as much as possible through chelation, preventing strokes, heart attacks, and coronary artery issues. When they're established, we can also assist the body in reversing these risks and reducing these risks. Chelation might involve a number or a series of intravenous or other ways of getting the heavy metals out. Typically, through our training, it's generally recommended to do 20 over the course of 6 months or a year, and remeasure those heavy metals if we've measured them to begin with. One of the things that was done in the last 10 years is the treatment to assess chelation therapy, also known as TACT, T-A-C-T. TACT trial was a study that was done on 1,500 participants and showed with a greater than 40% benefit the ability to reduce cardiovascular events, including heart attacks and strokes. It also is sensible. We don't want to carry toxins that we don't need, because they're going to affect our body in some not so good or adverse way. So getting rid of toxins, well, that's something our body naturally does to some extent. Chelation just really boosts the body's ability to get rid of toxic metals. So consider this when you're looking at your best health and how to prevent diseases down the road. Chelation therapy is one of those ways. So call us and come talk to us. We're glad to answer your questions.